I'm going to show you some features of how to perform a physical exam on your patient. This process is a little bit different on the computer as opposed to VR. So I'm going to show you both, but I'm going to perform my physical exam in VR at the very end, just because the screen is a lot more stable when I'm on the computer. Now, when you're on the computer, everything will be in 2D mode like this. You can click this button and it will recenter the patient. So if I come back a little ways and I click this, it will recenter him. And then this button here will allow me to look down and see all of the tools I have available to perform my physical exam. When you're in the VR headset, all you need to do is look to your right and you will see this setup with all of the tools that you need. So the first tool I'm going to show you is our otoscope. And when you're on the computer, it will light up blue when you're available to use that tool. So I'm going to click here and it will log on the right that what I've done and what I've checked. And then on the left, it will give me some findings and it will show me an image of what I see. So I'm going to use the otoscope there. You can also use the otoscope to check your patient's nares. And then one thing that's different in clinical practice, I would use an otoscope to look in a patient's mouth, and you'll notice it is not giving me that option. This is where we start to see some of the quirks of the system, some of the things that aren't really as true to life that we would see in a clinical situation. So in order for me to look in the patient's mouth, I actually need to use this magnifying glass. So I'm going to click this up here and you'll see it gives me an option over his mouth and I can look in his oral pharynx. I can also use this magnifying glass to do a skin exam and then to look at his neck. I have a stethoscope available here, and to use it, you just click and you simply auscultate in all the areas that you would normally auscultate during a physical exam. You can also use the stethoscope to listen to bowel sounds. You are able to walk around to the back of the patient in VR and listen to posterior lung sounds. It's a little bit difficult to show you how to do this in the computer mode, but do know that all you need to do is just walk around behind the patient and you can put the stethoscope on him and you can listen to lung sounds. We also have our ophthalmoscope, and it will show me the results here. And then we have this glove. This is something that you will not see when you are in a VR headset, but when you're in the computer mode, the glove is what you use to palpate. So you can tell me, so you can see this is where I palpate his thorax, palpate his abdomen, and it gives me all of my exam findings. And I will show you how to do that in VR mode at the end of this video. The last two tools that you'll see here, the blood pressure cuff and the thermometer, you do not even need to worry about picking up these tools. For our purposes, if you need vital signs, you just click on the vital sign button at the bottom. So if you want to play around with these tools, that is fine, but it is not something that will affect your grade in any way if you use these tools. Another thing I want to point out is, you don't need to do a full and complete physical exam on every patient. Do the physical exam findings that are pertinent to the case that you are doing. So in some situations, you may use all of these tools. In some situations, you may not. Now, you'll notice if I wanted to look, let's say, at his lower legs, it's not really giving me an option to do that. And if I ask Alex, can you lay back on the Alex, can you lay back on the table for me?
Would you mind being more clear?
He doesn't.
I'm having trouble understanding your question.
he doesn't understand and he's not able to actually lay down on the physical or on the exam table. So again, this is kind of one of the quirks of the system. So in order to perform other physical exam findings outside of the options available on the table, I do need to click this little man up here in the corner, and you'll see I can check his extremities, general observations of how he looks, a GU exam. You'll see there's lots of additional options. And this is where you have to go if there are other physical exam options that you would like to click. Now, when you are on the computer practicing, you will just automatically see this in the upper right-hand corner. If you are in the VR headset, you will have to switch into 2D mode in order to see this and to do these additional options. And I am going to show you how to do that next. All right, I am now in my VR headset, and you can see all around me, it looks like I am in a clinic room. Now I do want to show you there's a shortcut menu. You will see this every time you log into PCS Spark, but for the purposes of this video, I want to point out at the bottom it shows you can double click to re-bring up that menu. There's a button that you can click to pick up your patient tools, and then a button you can pick in order to use a patient pool, and then a button on the left-hand side there to switch to 2D mode. Now I'm looking back at the exam table on my right, and I click the button that the menu showed me to pick up my tool, and then as I approach his ear, you will actually feel your handset vibrate when you're in a spot that you can use the tool. This is different than on the computer where you see it will light up blue. You will actually feel your handset vibrate. When you're ready to use the stethoscope, you simply pick it up and place it on his chest, and you will be able to auscultate. You will notice on the table we don't see a glove like we did before. Instead, we just reach out and touch his abdomen, and it will show that we have palpated. And finally, when you're ready to go into 2D mode, with the left-hand trigger, you select the button, and you'll notice that we can see that bar along the bottom again. That gives us the additional menu, and then in the top right corner, we see that little man that lets us select our additional options. And that's how you perform a physical exam in VR.